Alrighty. Well, welcome everyone. Thanks so much for being here. We've got a great presentation for our coalition meeting today. And for folks who want this, we've got the closed captions running on the bottom. So you should be able to see those if you want to turn those on. And then if you need anything, definitely drop it in the chat throughout. But I don't have any specific coalition announcements other than welcome to 2023. If you are like me, you're still writing 2022, so that is an adjustment. We've been lucky so far here down in the southern part of the state to have a pretty mild winter, so hopefully that will continue. We have a great presentation today from the Wisconsin Board for Developmental Disabilities, and they are going to just take over on the spotlight here and be ready to go. So like I said, if you need anything, drop it in the chat. If you've got questions, drop those in the chat, but we should have time at the end as well. And thanks so much for being here. All right, Sally and Caitlin, I'll pass it over to you.
I'm gonna try to share my screen. So it's always the first challenge, but we just practice. So I think we'll be good. Just give me a second to get it up and then get it going. All right, I got to do one more thing. Oh no. I said my Zoom is trying to quit on me. All right, are we good? Can you see it? Does it look presentable?
It's still saying started screen sharing for me, Sally.
Oh, see, it's something with my Zoom.
I know we tested it on this Zoom link and everything, but it's
no, but I just got an error from Zoom. So hang on.
For the record, everyone, we literally did just practice this.
I know, but when I went to share, it said I had an error. So hang on.
That's better.
Okay,
That's
hang
better.
on. I just gotta switch it on the other. My other screen. All right, how about now?
It's still.
It keeps saying I'm crashing my Zoom somehow.
I can always open it too, Sally. It's just one of those things.
It says, please restart. It has unexpectedly stopped. Let me give it one more shot. Okay. I'm so sorry, everyone.
Don't worry, Sally. Let's just collectively decide as a group that if you ever in a presentation and you have tech issues, it's considered good luck from now on. And good luck. So
well, and Carly, you were just saying that you've been having Zoom issues. So I was like, oh yeah, I've been okay. Not really, I guess. All right, this will be the last try. We'll see what happens.
I'm having a Zoom issue.
You are too.
Do you guys see my background and then me in a circle?
Yeah.
Yes,
okay, that's never happened before.
All right, how about now? Is it showing? Does it look good?
You're not sharing at all at the moment.
All right. Is it sharing now?
No. Would you like me to try, Sally?
Yeah, it's not working. It's not even letting me share now. Yeah, it says I have an error for screen sharing. That looks great, Caitlin.
Does that look right?
Yes. Thank you.
All right, I'm just going to check that. Oh, I'm just going to check that I can advance the slides though, because sometimes that's the issue.
Okay. Yep. that works perfect.
All right, we
All
figured
right.
it out.
Well, hello, everyone. I'm Sally Flashberger. I'm from the Wisconsin Board for People with Developmental Disabilities, and I am the project manager for the Living Well grant. We will share the PowerPoint, and Caitlin can throw a link in the chat, or I will do it at some point. And I'm joined by my coworker, Caitlin. You want to introduce yourself?
Yeah, hi, my name is Caitlin McNamara. I am the project coordinator on the Living Well project. And yeah, I think we'll get a little bit into what the project has been doing and the stuff that we work on together as we go. So I'll let Sally tell you a little bit more about what we do.
Sounds good. Next slide.
There we go.
All right, so we work on what's called the Living Well grant, and it is a 5-year demonstration grant from the Administration on Community Living, and it focuses on improving the lives of people with disabilities who are using long-term care. So, so the grant was meant to improve people's independence, integration, safety, and well-being. How we are implementing this grant is we have been working with 8 service providers, long-term care service providers around Wisconsin. And we also work with 10 self-advocate leaders, and they have been implementing an intervention package, which includes many of the resources we're going to share with you today. Those 3 educational tools that we've been using are called Healthy, Safe, and Connected Toolkit, our Safe and Free kind of conversations, we call them, and then our Let's Talk About Rights guides. Next slide. So one of the things that we really wanted to bring to the group today was kind of how social isolation and loneliness can affect people with disabilities, and it may have some differing effects than older adults. We know that there's a lot of data out there regarding safety of people with disabilities and not just health outcomes when they are socially isolated or lonely. So we wanted to talk about some of that data that we have been using with the grant, and that might be important for this group to consider as we're thinking about people with disabilities and how the coalition might be trying to be sure that we are looking at all necessary means to increase social networks and social capacity for people. So one of the tools that Wisconsin uses to kind of gauge people with disabilities and the quality of their life is the National Core Indicators. And so this is used across the United States. It's a tool that our state has decided to use to look at long-term care outcomes. And so people with disabilities and their families are interviewed by the state using National Core Indicators questionnaire to try to measure how public systems are supporting people, specifically with intellectual and developmental disabilities. And so these questions focus on multiple quality of life domains. So many of the things that you might think, living situation, jobs, community interactions, all the things that we would be looking at as part of this coalition. And so I've put a link to kind of the overall National Core Indicators website, but then I also put in a link for the data oh, I just see that I didn't delete something on this slide, but I'll talk about that next. So this is our Wisconsin data, and the most recent information was from 2021. Next slide. So these are some of the Wisconsin data that we believe kind of can contribute to social isolation and loneliness. And so as you can see, there's a focus on employment and whether people with disabilities are employed. Are they employed in the community? Are they volunteering? Are they able to get out into their community, either through entertainment or even just going to restaurants. Are they able to participate in religious services? Do they participate in community groups? Do they see their friends? Do they want more friends? How often are they feeling lonely? Are they part of community groups? So you kind of get a flavor for some of the questions that are asked in the national core indicators. And as we go down, we'll kind of talk about, some of the areas where people are more suspect for abuse and neglect if these things are not present. All right, next slide. When we began our grant, one of the areas that we focused on was the national core indicators had listed predictors of abuse and neglect. And so, as you can see, a lot of the things that we're working on as a coalition are here. So the top, looking at social isolation and having lack of those friendships beyond paid staff, social stigmas, lack of privacy, ignorance of individual rights, staff stress and lack of training, dependence on other, lack of control and decision-making, quite a big one we have focused on quite a bit, and lack of community participation. So these were from the National Core Indicators, some of the things that they have pulled out that would really be those predictors. So we have focused a lot in these areas. Next slide. So besides using the National Core Indicators, we have engaged with the Council on Quality and Leadership. So they are called CQL. They are a national organization that really does look to improve the lives of people with intellectual, developmental, and psychiatric disabilities. And they work with human service providers, national organizations, governmental agencies, all around the country. And they have really focused on bringing quality person-centered plan implementation, and and they focus on that through training, but then also collecting data. We have partnered with them to bring different trainings to our service providers and what we call our stakeholder consortium. And one of the tools that we have used with CQL is what is called their personal outcome measures. So that is an individual, very lengthy interview process, similar to some of the questions that National Core Indicators might ask individuals. And we have interviewed over 155 individuals around Wisconsin. And that has given us quite a bit of information, which I'm going to share some of that specific information about Wisconsin later on. But really, we have had CQL train our provider agencies on what's called their basic assurances. That's kind of their overall quality, building quality plans on quality frameworks, and also human rights committees. And so human rights committees are really looking at the rights of individuals with disabilities and the ability to be sure that there is review when people feel their rights are being denied. Next slide. So one of the things that the Council on Quality and Leadership talks quite a bit about is building that social capital for people with disabilities. And so, so thinking about the relationships and the social networks that people have in their lives and how that affects their health and their overall quality of life. And so just like us, we all need to build our social capital, and that can be more difficult for people with disabilities. And so they talk about how social capital improves physical and mental health outcomes, and that improving access, social capital can improve the access to resources, resilience, and mutual aid. So really thinking about, the more people you know and are connected to, the more likely you are going to be able to be connected, whether it's through employment, community, whatever those things might be. And so again, I talked a little bit about using the personal outcome measures as an interview process. And those domains look at human security. So what we might think of as abuse and neglect, relationships, community, choices, and goals. All right. So one of the things that they did with so they collect all the data on all the personal outcome measure interviews that are done around the country. And so they have been collecting, I think they have been in operation, I think, for 20 years, 25 years. So they have been collecting data on through these interviews for many, many, many years. And so what they found was that only about 39% of people with disabilities would be categorizing as having that social capital index present. So when we conduct the POM interviews, it's kind of, is this present in someone's life or is it not? And so that's what they say. So a pretty low number on the social capital index. And these were the areas where people answered those questions about what would be considered effect of social capital. So having those intimate relationships, participating in life in the community, having friends, being respected, connected to natural support networks, living in integrated environments, interacting with members of the community, and being able to perform social roles. So just like you and I, part of our social roles might be going out to work, might be engaging with our religious community, it might be working at our schools. So all those areas were lacking, which made up for this 39%. Next slide. So through the gathering of data, we have worked with CQL not only with the data that we have been collecting, but also what they see. And so generally, the common risk factors for abuse, neglect, mistreatment, and exploitation do really include that social isolation and those smaller social networks. We know that people with disabilities are 3 times more likely to be free from abuse and neglect when they exercise their rights. And you might say, well, what does exercising your rights have to do with social isolation and loneliness? Well, I think one of the things that we often see is that if people are living in congregate settings, if they have a lot of services, that sometimes they are not able to do what they want. So they do not get to choose what they want to do during the day. They don't get to maybe engage in the community like you or I do. They may be told they can't have a job. They may have a guardian that says, you can't have a job. They may not get to pick where they want to live. So all of these things, all of these areas affect their ability to really be a part of our community and be included fully. And so we see that as a rights issue, and then we know that when people cannot exercise their rights, they are more at risk for abuse and neglect. Some of the other statistics that they have shared with us is that emergency room visits drop when people have natural supports in their lives. And so again, social isolation is really thinking about building more of those natural supports, that injuries lower when organizations help facilitate that desire for more natural supports. And then even that when people just have the right to visitors, so being able to come into their homes, if it's in a group home or a community-based residential facility, or even in their individual homes, if they have a guardian, if a guardian says, no, you can't have your male friend over to visit, all of these things can help reduce abuse and neglect, but also build up that social capital and think about social isolation and loneliness. Next slide. So I know this slide is a little bit small, But so we have been conducting these interviews with individuals at our 8 service provider sites. And we could link this report. We haven't done that. We do have a report that we can send out also where this kind of graphic lies. But these are the areas that have been focused on. And if you kind of move down the scope, you can see that choose where and with whom you live. Less than half say that is present in their lives. Choose where they work. Decide, let's see, interact with community members. Exercise those rights like we talked about. Participate in the community. Have intimate relationships. Perform different social roles. Connected to natural support networks, and have friends. So if you kind of look in those domains, they really do match kind of that social capital thought process that we saw through all the data from CQL. But this is our individual data from interviews that we have done in Wisconsin. So we can see that we still have a lot of work to do to include people with disabilities in our communities and help reduce their social isolation and loneliness. So I think I'm just going to look in the chat. All right, it looks good. Do we want to pause for questions, or Caitlin's going to go into some of our resources? So I don't know if anyone has any questions. If they want to ask out loud, we'd be happy to do that.
Sally, this is Carly, and maybe I missed you saying this. I heard you say it's a 5-year grant. What happens after that?
Well, that's a good question. So we are in our 5th year of the grant. And so we will be working on a sustainability plan all this year. Caitlin and I will be continuing an additional year. So we are working on a blueprint that will really talk about what we have found will be interventions that we think the state should adopt in long-term care. And so we will be publishing a blueprint in 2024 at some point. But it really is our goal to be being sure that some of these, especially some of the things Caitlin's going to talk about in the education pieces, that they really do live on past the grant for providing education for people with disabilities and their families. So.
Yeah, and I think too, I would just add, Sally, that as part of the, at least within the pilot sites, you know, the way that they have seen the usefulness of this kind of data collection in the way that they structure and reassess services, whether that's staff training or how they structure their day programs or things like that. We feel pretty confident that they will continue to use those strategies internally to guide conversations with folks and continue to gather this data for their own purposes. And hopefully they will be good advocates for other provider organizations and structurally like the MCOs and ICAs to continue some of that as well.
And we do have a consortium stakeholder group that we work with, and we have representation from the managed care organizations and the IRIS consulting agencies. So as we kind of work through this final year, you know, they are all very interested also in, you know, what can live on. Our 8 agencies are located around the state. I can probably tell you who they are off the top of my head. So we have Opportunity Incorporated. We have ODC, Aptive, Love Inc., the Down Syndrome Association of Wisconsin, C. Renee Consulting in Milwaukee, SOAR Fox Cities, Headwaters. So we tried to have representation in most of the areas around the state.
Yeah, so Rhinelander, Wausau, Marshfield area, we have some in Madison. There's 2 based in Milwaukee, 1 in the Fox Cities. So a pretty good spread geographically.
All right, I'm going to turn it over to Caitlin.
Awesome. I get to talk a little bit about how Sally and I and our policy team and consortium and our pilot sites have been trying to address some of those data points that we think are most concerning through the Living Well implementation. And the three areas I'm going to focus on are our rights guides, our safe and free, and most extensively on our Healthy, Safe, Connected toolkit. So the first thing I want to talk about is what we call our Let's Talk About Rights guides. There are 3 versions of this, one for self-advocates, so those that would be receiving services, whether they're sometimes called members, clients, customers, consumers, things like that, but we call them self-advocates. There's also a provider version. This is used for staff trainings within provider organizations. The questions are, the rights are the same throughout all 3 guides, but the questions that guide conversations are structured, whether it's group conversation for self-advocates, an opportunity to have conversation at staff meetings, and then for families and guardians about how their role as a natural support to an individual can affect their ability to exercise their rights. The guides address 17 human and choice-making rights that people with disabilities have, but don't often learn about or exercise fully. There's a huge range of what we would consider human rights, things like voting, the right to go to school, the right, protection within the law and within your services is something that are all rights. But then there's this broad category of choice-making rights that we think get at the heart of the ways in which people can become socially isolated. And that's the right to make your own schedule for your day, the right to talk to and be around the people you want to, the right to live where you want and with whom you want to live with, are all choice-making rights that individuals have, but sometimes within the disability community, those rights are restricted, either, outright, somebody saying, no, you can't, or because the self-advocate hasn't been given the tools to communicate or exercise that right fully. We've included a link here to these rights guides. All 3 versions are available there for you to see. These guides are in our kind of final stage of development. You can definitely download the versions that we have. They're very good versions, but we are very committed to getting all of these materials properly tested. So they've gone through focus groups, the pilot site staffs have gone through them and given us feedback. Self-advocates are using them and giving us feedback. We're always trying to make them the most accessible and making those tweaks that make it more easy for people to use in their day-to-day lives. The second implementation strategy that I wanted to mention is what we call our safe and free conversations. The sessions there's 12 sessions on self-advocacy topics that range from safety at home, safety in the community, relationships, voting, communication, and they are led or co-led, I should say, by a self-advocate leader. And that means that one of our 10 self-advocate leaders who have gone through professional development and training work with a pilot site organization and somebody within that organization to not only put the class together, but lead conversations, share their own experiences, develop ways to have these conversations with people in the room while staying true to the material. But we get a lot of feedback from our self-advocate leaders about how they're having these conversations with folks that is eliciting a lot of good conversation and good thought. It gives people with disabilities the opportunity to talk with one another about shared life experiences and also to, do a little bit of planning and goal setting for how to take action in the future. There's a lot of times where, they've had an experience in the past that they haven't liked the way it's gone, whether it's voting, a relationship, being safe, something that happened to them that they were unhappy with. And the activities and the space that they're given in these in these conversations gives them the chance to talk about how they might do things in the future, what they might want to change. And it is leading to a lot of really good social connection between those individuals as well. And we're seeing, the ripple effects. Our self-advocate leaders have been sharing a lot with us about the way that they are seeing the people that they work with blossom and take more action in their lives and want to get more involved, want to get a job for the first time, want to go vote for the first time, things like that. So that is another way that this tool, these two tools, really help change the trajectory for people on feeling socially isolated. But what I wanted to focus on a little bit more in depth than just that quick overview is what we call our Healthy, Safe, and Connected Toolkit. And I wanted to mention that this was actually a toolkit that was born out of the pandemic. Early on, when everything shut down, and people with disabilities who had been living going to pretty isolated environments to begin with, or very structured environments, I should say, lost some of those opportunities very quickly, and the landscape became something where we were very acutely aware that all of the support that keeps people safe was falling out for people with disabilities, because those supports were very structured, were paid supports, because people were lacking in social networks, because they didn't have social capital and were more isolated. And this was true for all of us during the pandemic, but especially for people with disabilities. They were at a huge risk of being that there's something bad could happen to them, especially because a lot of times there just wasn't anybody who was checking in to see how things were going. And that was, not only was it socially isolating for them, but it was leading to some serious health and safety outcomes. So we started by making a toolkit focused on how we could connect and give resources and advice to people with disabilities in plain language for dealing with the changing landscape of COVID, and for staying as safe as they could while we were all sort of figuring out what to do. And then as we know COVID isn't completely gone away, and we know there's lingering social isolation and connected effects from COVID. But as we moved into our new normal, we recognized that this toolkit was going to be useful beyond the scope of just the pandemic, and as a guide and a conversation starter, and a really actionable set of documents to help people stay safe, healthy, and connected in their communities. So we have a Stay Healthy section. It gives a lot of really good information, not just about how to stay healthy, but there are interactive tools in there about how to talk to your doctor about accommodations that you need, how to set up a doctor's appointment, how to make a grocery list. It doesn't give any, it doesn't say, here, you need to eat 7, fruits and vegetables a day, or here's what you can and can't buy at the grocery store to stay healthy. It is really a tool to put that choice making back in the hands of people with disabilities, to say, I wanted to go to the grocery store and buy these things. I want to go out, to the YMCA and walk on the track. I want to go to the doctor and tell them that I feel like I need, this in my life to be healthy. So that is the goal of the Stay Healthy section. The Stay Safe section is about, it gives a short overview on how people have rights, when they would need to communicate with somebody that they were unsafe or that abuse was happening to them. There's a My Safe Home plan, which gives people the opportunity to just go through their house and make sure that they have all their basic needs met, and what they should do if those needs aren't being met. It provides a plan of action and a call log so that people can keep track of who they're talking to if something bad does happen, what that person's job is, when was the last time I talked to them, what did they tell me was going to happen next. And that way they can share that information with people that they trust and know that they're staying on top of getting a resolution that makes them feel seen and heard. We don't want bad things to happen to people, obviously, but we want to give them the best opportunity to have a healthy and safe outcome and make changes in their lives so that they don't re-experience abuse or a traumatic situation. But the thing I wanted to focus on, especially for this group, is the Stay Connected section of the toolkit. It's about positive ways that we can help people look at their lives, think about what they want, and find ways to build, maintain, or expand the connections that they already have. So in this section, we talk about mapping relationships, making a list of ideas of things that they want that maybe they don't have yet, how to find new opportunities. We know that transportation is a huge deal for people with disabilities, and so giving them some ideas on how they can get there, who they can ask, what resources exist out there. We talk about connecting with technology, and I'll talk a little bit more about that on a later slide, how to stay safe online, and then a plan that's called the My Stay Connected plan that gives them a place to write down not only what they're interested in doing, how they can do it, but also who they might need to involve in their lives to make that possible and sustainable. So this is the Map Your Relationships. It's the sort of guide page in our Stay Connected section. The following page of the guide is a big version of that circle where people can map their relationships themselves. It is a way for people to just like observe and think about what they've got going on in their own lives, because a really important place to start is with what already exists and how you can utilize those existing connections to build bigger and more meaningful connections. We had the opportunity to see this in action at the Self-Determination Conference this last October. We took the Stay Connected section with some of our self-advocate leaders to a group there, and we asked them to do this activity. And that was both people with disabilities, their supporters, people who work in this field. We asked everybody to do this activity. And the comments that we got across the board were, I never thought of this before, or I've always wanted to know more about this thing. And I've never thought about, who I know in my life who does this. Whether that's, I always see the woman at church working on her needlepoint. And I've never thought, I've always wanted to get into arts and crafts. I never thought to ask her about that. I've always just really observed that relation, that person in a different environment, and never thought to expand it to something that I was interested in. So it really, I might just encourage everybody to test it out and see if you're feeling lonely or like you need a good activity to jumpstart some creative thinking, especially in the new year, about places that you can go to be more socially connected. We talk about 3 different areas in this map: skills and interests, community connections, and places you go, work, or learn. So you get to write down the things that you have skills in or have an interest in: puzzling, biking, or community connections that exist. Maybe you always have a really great conversation with the barista at the coffee shop, but you've never thought to ask her to get coffee after her shift, things like that. And then places you go, work, or learn, we sometimes compartmentalize our lives for lots of really good reasons, but it's also a good opportunity to say, hey, I go to this place all the time, but I've never thought to expand my role there. So outside of the mapping your existing relationships, we do get into the ways that technology can be helpful for people with disabilities and really everybody in staying connected. We definitely saw during COVID that we had to work to get people connected to technology in order to take advantage of the safe ways that we could get them interacting with other people. It is a really fantastic tool to use. However, we know that nothing really, can take the place of in-person and physical connections with people. And so while we want to make sure that online spaces are accessible to people with disabilities, that they know how to use things like Zoom and other things, we also don't want it to be a replacement for those, person-to-person connections in our communities as well, because technology alone in this little Zoom bubble can also be very isolating. And then we talk about ways to stay safe when using the internet to connect, because we find that a lot of people with disabilities are either completely excluded from online spaces for safety reasons, or they are never given the tools to explore safely what the internet and social connectedness this way can offer them. And so we talk about, what kind of information would you share with somebody that you've never met? What kind of information, when is it safe to take an online interaction to the real world? Those kinds of things. The next part of the Stay Connected section talks about activities to try. It breaks them into different categories like career, learning, fun, and recreation. And there's a few other where it gives you a couple of activities within that space, that interest area to think about or to create your own. So it's just sort of a brainstorming tool to give people the chance to say, yeah, you know what, I don't have a job right now, but I want to go on some, job, shadowings, or I want to ask, I have a job and I want to ask for more hours, or I don't like the job that I have. I want to go to get a different job because I feel like if I worked somewhere else that was more aligned with my interests, I might meet more people that I have things in common with. Or, I want to go camping more. I always go to church on Sunday, but I know that they do bingo and I've never gotten a chance to go and do that. And I'd like to try that activity. And then the final part of the Stay Connected section is what we call the My Stay Connected plan. And really, this is sort of a way to pull all of those different tools together. Once you've gone through your map, once you've talked about the new opportunities that you might want to try, once you've thought about who in your life already exists in those spaces, here's a way to pull all of that information into a grid that says, yeah, in this, under health and exercise, here's something I would like to do. Here's a place that I already go to or know about where I can learn more about this, or a new place that somebody that I've been working with has told me about. Here's the person that can help me do that. Or I don't know, this is a blank spot for me and I'm going to need some support to find somebody who can help me. And a place to say, how am I going to get there? Is it accessible by a bus? Can I get a ride share with somebody who's already doing that activity? And then, when there's a blank, then it gives people an opportunity to have conversations with those in their lives to fill that blank in and make it possible for them to do that activity and get more connected in their community so that they are safer and healthier. All right, that was a very, very fast overview of some of our tools, and all of them are accessible in the guide. We've got links to all of these things. We're always open to talking more about it. Sally and I can talk about living well stuff all day. Talking about it is not our problem. So we're happy to answer questions about either the data or some of the tools we've been using. And certainly if they come up later, you can reach out to us and we will answer any questions you have as well.
I would just add too, for all three of the resources we shared, we have been doing evaluations. So we initially did the COVID Toolkit. We did a pretty large implementation with the managed care organizations, our providers, and that helped us develop the final Healthy, Safe, and Connected Toolkit. And then, as Caitlin talked about, we're doing evaluation on those other two also. So part of what will be moving forward is kind of some of the data we've collected to see how, to show the success of using peer-to-peer models for education, but then also the tools themselves. So.
Yes, and I think a good follow-up to that too is that these are some of the things that we've been working on over the last 4 years that we would really like to see embedded into practices, whether at a policy level at the state or within MCOs, ICAs, provider organizations, so that these kinds of tools that we now have evidence help address social isolation and loneliness don't sort of just disappear when the project ends, because we do have a good amount of data and research and evaluation behind it now to say this is working to help people build those connections and feel less lonely and more connected to their community. And so where is it within the state system that it can live on and continue its progress towards addressing these issues? All right, I'm going to stop sharing. That way I can also see the chat if there are questions. Oh, yes, that's a great point, Chris. The Stay Connected section of the toolkit in its fillable version is available on the coalition's website. So certainly that's a good place to grab, especially that Stay Connected section.
All right, well, it doesn't look like there's any questions. I think I'm gonna turn it back to Carly, but we'll be here if you have any questions, or you can always email us. And Caitlin, will you I can throw the link in the chat. I have it. I will do that right now.
Wonderful. Thank you so much, Caitlin and Sally. Corey just commented in the chat that I bet these empowerment and coaching resources will be effective for other populations too. So
yes, for sure. I was saying before we got on that I'm part of the access and detection work group. So we've been piloting the UCLA social isolation and loneliness tool, whatever we call it. But I do know that that was a resource that others were using as to make to help if the screen showed that they were socially isolated or lonely, that some of the ADRCs were using that tool.
Great. Wonderful. Well, if folks do have questions, you're welcome to drop those in the chat or come off mute. Otherwise, thank you so much, Caitlin and Sally, for your presentation. I really appreciated the detail that you went into. And, sort of walking us through how you might use each step of the process. And, I think it's helpful to just take a moment to dive in because there are so many resources out there and we don't always take the time to really focus. So I really appreciate you doing that. Michelle also just commented in the chat that the Bike Fed has resources to help with walking and biking for transportation, and to let Michelle know if you want to be connected.
Yeah,
so,
that's great. Okay, definitely. I will.
Wonderful. Awesome. And just lots of compliments in the chat. So, well, thank you all so much for being here today. Really appreciate it. We have been recording this, so this will come out in case that you want to share this with someone else or you want to re-listen. And then we will also share the PowerPoint along with that recording. So might just take us a little bit to get that processed. So our notes may not be as fast as normal, but that will come your way shortly here. So thank you all so much, and I hope you have a great week.